too much. Your incision looks really good. You're healing very nicely. The next thing we're going to do is put in an NG tube. So I'm just going to move my supplies around here. So I'm just going to kind of move stuff out of the way, and I'm going to have, so the wound care, I need to see you setting up that wound care table. The NG, you can have all your supplies laid out and set up and ready to go. And you can just pull that table in. If you want to walk to the other side of the bed and you're comfortable with that, that's okay as well. But I have everything I need, and I'm going to do the bolus feeding first with him. So Mr. Fisher, we have to put an NG tube in because you're having a little trouble swallowing from your stroke, and it's dangerous for you to try to eat because it may give you a pneumonia. So one of the things that we're going to do is put this feeding tube in so that we can get you adequate nutrition for healing. So the first thing I'm going to do is I'm going to do a few assessments to make sure that we can get this in comfortably for you. So I'm going to check his gag reflex. Gag reflex is intact. I'm going to look at I'm going to check your nose to see which areas it might be better for us to put it in. So I'm going to occlude one, and I'm going to look and have him breathe. I'm going to occlude the other. Okay, it looks to me like we'll put it in the left side. That looks to be the most patent. The other thing you want to do is you want to listen to bowel sounds. You want to palpate the abdomen to make sure there's no abdominal distension, those kinds of things. Okay, so in order to do this, Mr. Fisher, we're going to have you sit up. Patient position important, 45 degrees. So, and this is another place where sometimes students lose points, because when you do the abdominal dressing, to have him sitting up at 45 degrees is uncomfortable for him in a bad position. So you want to make sure he's down for the dressing change, and then you put him up to 45 degrees to do the NG tube. So the NG tube procedure is a clean procedure. Okay, so you don't need sterile gloves. You don't need to maintain sterility. I'm going to wash my hands. I'm going to put my gloves on. And the first thing we're going to do, Mr. Fisher, is measure the tube to see how far down we need to go. So. Now, in real life, I wouldn't put my gloves on yet, okay? But for the demonstration and for the video, you're supposed to. So do you know how to measure an NG tube, to how far you go? So nose to tip of the ear to xiphoid process, okay? So this is how far down I want to go, and I'm going to mark that with a piece of tape so that, again, I don't go too far once I get the tube in. Okay, so I've measured my tube. I'm going to provide a cover in case he gets nauseated, so I'm going to provide some protective cover. I'm going to put some lube on that so I can lubricate the tube. I am going to give him a cup, and this is where sometimes students get a little creative and they have one of their videotaping partners say, I'm going to have the nursing assistant come in and help me and hold the cup, but you can give him a cup with a straw in it so that that one of the ways that you can get him to swallow the tube better is to have him take a sip as you're passing the tube. Okay, Mr. Fisher, this is going to be a little uncomfortable for you, but we'll get it done as quickly as possible. Tube management important so that you don't have the tube flapping all over the place. I'm going to lubricate the tube. Okay, I'm going to put this into your left nostril, and when it gets to the back of your throat, I'm going to have you tip your head forward so that we can get it into place, okay? If at any time, Mr. Fisher, you're feeling uncomfortable or it hurts too much, raise your right hand, and I'll stop, and we'll give you another break. Again, the issue there is I don't want him raising his left because that's the side that I'm on. So be careful about that. Okay, so I've lubricated my tube. I've measured. I'm going to put it into the nares. I'm going to go to the back of the head when I feel resistance. I'm going to have him tip his head forward. And this is where it can be difficult. Usually for the videotaping, the tube will go in pretty smoothly. Okay, so it's plastic on plastic, so I'm not getting it in. So I'm going to say, okay, we've gotten to the point of the tape. Now I'm going to anchor it. Always anchor your tube, okay? So I've prepared some tape that has a split in it. I'm going to put that on his nose, and I'm going to take the split of the tape and wrap it around the tube. Okay, Mr. Fisher, you tolerated that really well. Now that your tube is in place, we're going to have to check some things. So the first thing I'm going to do is I'm going to listen. And does somebody have a stethoscope? So, there's several checks that you have to make once you get the NG tube in place. So how you organize those checks is part of the grading process. It has to make sense for you. So, okay, Mr. Fisher, I'm just going to remove this little cover here, and I'm going to listen to see if I can hear this down in your stomach. So I'm going to take my syringe. I have some air in the syringe, and then I'm going to listen to his belly with the stethoscope. Okay, and I'm listening for a whoosh. Okay, good, Mr. Fisher. I hear that whoosh very well. Now I'm just going to withdraw some fluid from your stomach to make sure, again, that we're in the right place, because the fluid in your stomach has a certain color and a certain pH. So I'm going to do my withdrawal. I'm going to cap the tube, put it up here, and then I'm going to come over here to my gastrocult, and I'm going to put some of the drainage on there, and I'm going to say, oh, good, the gastric pH is 4. That's what it should be, and there's no apparent blood, so that's also very good. So then the next check you're going to do is you're going to check for air bubbles in your water. So you take the end of the tube and you hold it in to underneath the water. There's no air bubbles. That's good. If it's in the lungs and he's breathing, you'll get air bubbles. Okay, so it looks so far that things are in place, Mr. Fisher, but the last thing we're going to do is we're going to send you down to X-ray for a X-ray so we can see that the tip of this tube is in your stomach. You've done really well. Do you need to have your mouth cleaned out before you go to X-ray? Oral care, important. That's one of the pieces, and the students uniformly say the patient denied need for oral care, so they don't have to do it. Okay, I'm going to put your bed down, and I'm going to call the transport to get you down to X-ray, and then once you come back from X-ray, we'll be able to start your feeding, hopefully. Okay, so then, I take my gloves off. I'm going to keep this for the next piece of it. Patient goes down to X-ray. They come back from X-ray. Now, the key piece on this, and sometimes the leadership students will tell you don't have to do this. Key piece on this is that you need to redo all your assessments when you come in to do the feeding, because patient's been out of your sight. You don't know what's happened to that tube between, when you left and you went to X-ray and came back. And even though you might have an X-ray that validates that the patient, that it's in good placement, you need to recheck. Anytime you do anything with an NG tube, you need to recheck. So, Mr. Fisher, I'm glad you're back from X-ray. I got the report from the radiologist, and it looks like that tube's in good place so that we can start your feeding. So again, I'm going to wash my hands, provide for privacy, get my gloves out. I'm not going to put them on right at the moment. Okay, so what we're going to give Mr. Fisher is Isosource HN 1.2 calories. We're going to give him a bolus feeding of 250 cc's. We're also going to give him free water of 200 cc's 3 times a day. So we're going to give him some free water. We have all that ready to go. But before we do that, I'm going to do some additional checks of that tube. So I'm going to, listen to his belly. Okay, good bowel sounds, and that's important. Belly is soft and non-distended. I'm going to listen for air again. So here's where you can put gloves on. From my perspective, you don't necessarily need to, because as long as you manage the tube well, you're not going to get anything on you. But this is where you should think about putting gloves on. I'm going to put the air in your stomach and listen again. Okay. Good. I hear the air in your stomach. That's good. And you're going to also then check aspirate again. Okay. Now, in doing it for this part of it, you're aspirating gastric contents. You're also checking to see if there's a lot of gastric contents in there, because you have a hold for gastric contents greater than 120 cc's. So I'm just going to aspirate here a little bit, okay, and the fluid is green, and I get back to 20 cc's and nothing more is coming out, so I know that there's very little residual in his stomach. I'm going to take that and I'm going to test it. So again, you're going to do your gastric cult. pH is 4, it's negative for blood, and I'm just going to put that back in. So the aspirate that you take out at this time, you're going to put back in. Okay, and then I'm going to get your tube feeding ready. So again, Isosource, 1.2 calories, it's 250 cc's. The expiration date is January 1st, 2017. It's not opened. I'm going to wipe off the top with an alcohol pad. He's to get 250 cc's, so he's going to get the whole thing. I'm going to put it in my container, get that ready to go. I'm going to take the plunger out of the syringe, okay? I'm going to put the syringe into the tube. I'm going to take my container and I'm going to pour. Okay, 50 cc's, raise it up, let it go down. Don't let it go all the way down to the bottom. Bring it down again, add 50 more cc's until you have 250 cc's. You're demonstrating to me control of the flow by raising and lowering the height of the syringe in relation to the patient. You never want to let the fluid go to empty here, primarily because then you've got air in the stomach. So again, you're telling me that you're preventing air from going into the stomach by continuing the feed. Okay, so now we're down to the last 50 cc's. And I bring it down just so that the last 10 or 20 cc's doesn't flow in, and he's due to get 200 cc's of water. You can have a secondary basin here with it full, or you can use this and you can go, okay, 50 cc's, 50 cc's, 50 cc's, again, up and down until you get the 200 cc's in, and then you take the syringe out and you clamp the tube, okay? Leave the patient at 45 degrees when you leave the room. Mr. Fisher, you tolerated that well. Did that make you nauseated at all? No, you're good? All right, well, I'm gonna leave you sitting up now for a little bit so that you can digest what we just put into your belly, and I'll be back to check on you in a little bit. Your call bell is here if you need anything, but you did really well, and that's your scenario, okay?
How much time do we have for this?
30 minutes. Now, I will tell you that in the last couple of rounds of videos, most of the students got all of this done in about 20 minutes, 22 minutes, I think. The key piece is being organized up front, you know, making sure you have all of your supplies, and kind of go through. Again, if you go down the grading rubric and go those steps through the grading rubric, you'll probably be fine. Now, if you get the scenario that it is, let me have that back. If you get the scenario that is continuous feed, the difference is that you're going to be using the pump over here. So in addition to doing all those assessments and things that we did to validate tube placement, you're going to put your solution into the central feeding bag. So instead of putting it in the container and pouring it in via the syringe, you're going to put it in here. So the order reads Isosource 1.2 calories, 20 cc's an hour. The key piece in this one is how much you put in this bag, okay? whenever you put up tube feeding, that's gonna be a continuous tube feeding, it's only 4 hours worth of volume, okay? And the biggest mistake students make in this scenario is they put the whole 250 in the bag. Well, 250 at 20 cc's an hour is way longer than 4 hours worth of tube feeding. So 80 cc's goes in the bag. You mark the bag, just like we talked about with your topical medications, with a tape that has date, time that you put it up, and your initials. You put the 80 cc's in the bag, and then you take the tubing and you connect it to your pump. So the round circle goes in the top, this comes up around the bottom, and that goes in like so. Okay. And you're supposed to demonstrate this to me on the videotape. So you get the bag in, you turn the pump on, okay? And then, so this tells me that there were prior settings on the pump. So I want to clear the prior settings because I'm going to put my settings in. First thing I'm going to do is prime the pump. So what you have to do is you have to prime the tubing because you can't put this attached to the patient without the tube feeding being all the way to the tip. In the old days, we primed the tubing before we ever put it in the, in the pump because there was a controller on it. Now I don't know, this bag setup is different than the last group used. In the original one, you only had one bag, and that was your enteral. That was where you put the tube feeding. This is set up that gives you a flush bag and a feeding bag. So in this scenario, if this is what they have in the lab for you when you come in to do your videotaping, you put your tube feeding in the purple bag, and you put your water flush in here, in the blue bag, blue for water. The scenario is that the patient's going to get 150 cc's of free water. So you would put 150 cc's of free water in here. You would put your 80 cc's of tube feed in here. When you turn the pump on, the first thing you do is prime. So you hit the top button that says prime, and then you kind of hit auto prime. Now, it'll tell you it's priming, but because there's no fluid going through, it's really not going to prime. And then you and I'm okay if you sort of stop that just for time perspective, and then you go to done, and then you put your feeding rate in. So the next button down, it says adjust feed, and you go to feed rate, and then you want to make it 20, and then you enter, and then you're done with the feed rate, and then adjust flush. Flush volume is 200, and enter, and flush interval is, I think it's every 4 hours on the thing. So you put 4 hours in here, and then you hit enter, and then you hit run. Okay, so again, I'm not gonna be able to see this on your video. If you're doing it, you're telling me, okay, I'm priming, I'm priming the tubing, I'm priming the flush, I'm setting the rate to 20 cc's an hour. Now this is gonna tell you system error because there's nothing in it, so you can just sort of turn it off at that point. And then what you're going to do is, the other piece of the scenario is once you have it connected, so then you're going to connect this to the tube, and you're ready to go. The other part of the scenario is when you leave the patient, you leave them in an upright position, because anybody that's got a tube feeding running, they should be in an upright position while the tube feeding is running.
What's upright considered?
45 degrees or more.
Okay.
Okay. And then okay, Mr. Fisher, we got your tube feeding all set up. I'm going to put your bed down into the low position, but I'm going to keep you sitting up, and I'll be back to check on you in a little bit. And that's the end of your scenario.
How does the flush bag work? Is that
so? What happens is the pump knows. So if I put in here that I want this flushed every 4 hours, what it'll do, what the pump will do is it'll turn off the feed bag and push 200 cc's through, and then it'll go back to the feed, so it alternates back and forth. But the pump does that. There are. So what happens is, they come into here, and because the pump is set to flush every 4 hours, it draws from this bag